specimens we're testing, and we're only going to indicate if we have a positive confirmation, which we do not have at this time. All I'm going to say at this point is we have no confirmed cases, because again the definitions keep changing, and it's going to only be confusing if I try and keep changing the definitions as the Centers for Disease Control. What we have at this point, we are testing every day in our laboratory, and we will let you know if there are any confirmed cases. We have specimens from different parts of Los Angeles County being sent to us by physicians and by hospitals, and we are testing those. There are two issues. I'm sure that not everybody is reporting, but on the other hand, we have seasonal influenza as well. And in fact, the specimens that we've tested, while we have not been able to confirm swine flu, we can confirm that there's a continuation of the seasonal influenza to both types A and types B. And since the pattern of swine flu in the United States has been virtually indistinguishable from the symptoms of the seasonal flu, swine flu and seasonal flu have the same symptoms, you really can't tell. We have been getting an increased number of reports, and we've been getting specimens, and we are testing those. So I'm not concerned that we're not getting reporting, but I do think we have a big county, and it's likely we'll find it. We get specimens both from physicians and from hospitals. We discuss it with them. It comes into our laboratory. We do testing in our laboratory, and then for absolute confirmation it needs to go to the state and the Centers for Disease Control. We're going to provide results one time every day. I believe that's going to be at 1 o'clock, and we will let people know. But I can tell you at this point we have no confirmed cases. Oh yes, there is a confirmatory test. We need special reagents from the Centers for Disease Control, and we have requested those. And our understanding is that sometime the end of this week or beginning of next week we should get that. That will permit much faster testing than now is a several-step process. Well, one of the reasons I think that we always want to look very carefully at influenza virus is because of its a known ability to mutate. I mean, that's how we wound up with this recombinant virus that is a new virus, that it has some portion of bird genetic material, some portion of pig, and some human. And because they mix together, it increases the risk that it can have human-to-human transmissibility, because swine flu is generally a problem of swine. So that's one of the reasons we want to be increasingly vigilant. But that we have no way to predict if this will mutate, and if it mutates, whether it would become worse or in fact less severe. And again, right now, the pattern that we've seen is not distinguishable from the seasonal flu, and we still have seasonal flu. We also have a portion of the stockpile that we're drawing down, so we will have about 675,000 courses of Tamiflu. But generally, that's not something you'd treat a routine case with if it was mild or moderate. Anyway, it only reduces the length of time you have symptoms by roughly a day. And in addition, Tamiflu is not effective against some of the seasonal types of influenza, which are the only ones to date that we've found. So I think what we are doing is working particularly with hospitals. It's the severely ill cases that we want to make sure if they are treated with Tamiflu, that if the physicians want to treat them with Tamiflu, that they have them. And so we're in very close contact with the hospitals.